healthcare system in and of itself is just completely broken. The deficiencies in the healthcare system aren't for lack of spending money, right? Like, we're spending money and getting less and less every year. Isn't that right?
Over $12,000 per capita right now. Thailand, Brazil, Costa Rica, Sri Lanka. Every one of these countries is better than the United States. There are insidious ways in which behavior from physicians and clinicians are strong-armed because of the subtle incentive structures that exist in the background.
Wow.
They've done studies on how long it takes for a physician to interrupt you, and it's something like 30 seconds, And if you want the premium plan for family of four, you're literally talking $40,000 or $50,000 a year.
It sounds like we're locked in a death spiral. Doctor satisfaction is not high, and we're seeing an exodus of physicians from the system. Do we need a complete overhaul of the existing healthcare system? And if so, what are the first steps that we need to take?
It's not going to just change. We kind of have to blow it up and start over.
Listen, the U.S. healthcare system costs $12,000 per year per person, and yet we have one of the worst performing healthcare systems in the developed world. We will uncover the historical roots of this system, understand why it's failing so many people, and introduce a radical new approach to health and wellness. I'm Jack Murphy, and I'm the co-founder of Rebel Health Alliance, along with Dr. Sandeep Palakodeti here. We are going to explore a number of health and wellness topics. We're going to let you know about the ins, the outs, the ups, the downs, the goods, the bads of the healthcare, how you can navigate the system, what you can do for yourself in terms of getting healthier, more productive, happier, even wealthier, as a matter of fact. And along for the ride, I've got my good friend, co-founder, Dr. Sandeep Palakodeti. Dr. Deep is what we call him. How you doing, Dr. Deep?
Jack, I'm doing great. Thank you so much. Glad to be here. Glad that we're going to be bringing this show to folks and bring a lot of great information. I think we all know the healthcare system is uniquely broken and it doesn't work for any of us. So we'll talk about a lot of ways we can navigate that and sort of fend for ourselves. And most importantly, how we can keep ourselves and our families healthy and well.
Indeed. And the reason we're making this video is because part of our sort of thesis for starting Rebel Health Alliance is that the healthcare system in and of itself is just completely broken, and that we need a new approach to tackling healthcare, both on an individual level and hopefully on a national level. And I think it's a really great way to kick off this channel and to start the flow of content here with really just explaining the problems that we're facing and why we created the Rebel Health Alliance to solve some of these issues. So let's just get right into it. The reality of sick care in the United States. More than 70% of U.S. adults feel the U.S. healthcare system is failing to meet their needs in at least one way, according to a recent poll. Dr. Deep, does that jive with your experience? And why don't you tell us a little bit, too, about that experience so people get to know you? But do you really think that people are feeling like the system is failing them? Is this statistic legit? Is it on point?
I think it's actually a little low, Jack, to be honest. I think we'd all say there are aspects of the system that are not serving any of us. I've had the great opportunity to see the system. What are we actually talking about from the inside out? I'm an internal medicine physician. I trained in California. I did a fellowship at Harvard. And then I practiced at the Mayo Clinic, and there I was a hospital-based physician, and I saw kind of the end state failure of American healthcare. We fundamentally don't care for people and communities in the way that we need to. We are extremely reactive in what we do, whether it's in primary care or in advanced surgery. We're mostly focused on making sure you don't die and treating you after you've already been diagnosed with the disease. I spent most of my career helping people manage chronic diseases after they've sort of developed. And, unfortunately, most docs don't have the time or the resources around them to actually sit with people, coordinate with a multidisciplinary team, and really help them understand their health from the inside out. So, people would say it's broken in all sorts of ways. The average time that we spend with our primary care physician is 7 minutes. They've done studies on how long it takes for a physician to interrupt you before, as you start talking about your story, and it's something like 30 seconds, and unfortunately that's because They just have to get through a series of questions and, a series of measures that they need to meet. And unfortunately, when you sort of incentivize volume over value, meaning pushing as many widgets through the system as we possibly can, that leads to very sort of cookbook rote lines that we say, and we get people out. We write a prescription to kind of keep them moving.
Man, I think we can all relate to that feeling of the doctor coming into the room. You have been waiting. First of all, you scheduled your appointment at 10. You got there at 9:50 and they don't come into the room until 10:50. You've been sitting in this like cold room with a fluorescent light on that stupid paper on the examination table. And you've been sitting there waiting for this chance to talk to your doctor, this guy that you think is going to have the answers to your problem. Your hopes are sort of invested in their ability to diagnose you and solve whatever problem it was that drove you to make an appointment, to come in that day, to take time off from work. And you're really obviously hurting. You need something solved, and you're really hoping this guy or woman is going to be able to help you. And then they come in the room and they interrupt you, and they're brief and they're short. And sometimes you don't even feel like you get everything out that you want to get out. And you definitely don't feel like you're getting personalized attention. And that's a real roller coaster of emotions that people, I think, almost all of us can universally relate to that. What one thing I wanted to ask before we move on here is just the deficiencies in the healthcare system aren't for lack of spending money, right? Like we're spending money per person on healthcare at a rate that's just mind-boggling and getting less and less every year. Isn't that right?
Yeah, absolutely. I mean, as you mentioned in the introduction, over $12,000 per capita right now per citizen in the United States. That's the next closest one I think is Switzerland at like 8,000. Most other countries are 6,000, 4,000 below. And part of me actually believes that if we were spending the most on healthcare in the world and we had the best outcomes in the world, I actually think that ROI is probably worth it, right? Like if we have the healthy, educated society, they will be productive in all sorts of different ways. But that's not the case. Let me ask you, let's do a little pop quiz here, Jack. Tell me who you think over under has the higher infant mortality rate than the United States. So I'll name a country. Do you think they have a better infant mortality rate or worse than the United States? Norway,
Uh, Better,
Italy,
probably worse. I don't know
Germany.
why. I'm Italian racist or something. Germany, better.
Uruguay,
This feels like a trick question. Uh, Worse.
Cuba.
Oh, definitely better. And I just happen to know that one because I went to Cuba and talked to the doctors there.
Well, you were almost right on all those, but they're literally all better than the United States. Our children are dying at birth. And, there might be how you measure that and what sort of goes into effect. People will pick apart these numbers. Same thing when you look at life expectancy. Every one of these countries is better than the United States. Canada, France, the United Kingdom, Japan, Chile, Thailand, Brazil, Costa Rica, Sri Lanka. These are not countries that are spending anywhere close to what we're spending and not what we would even consider countries that have advanced healthcare systems, right? We are not getting fundamentally what we're paying for. So there's only two ways out of this. Either we need to stop spending that much money and reorient our system in a completely different way, or we need to drive up the value of what we're getting and be the healthiest population the world has ever seen. It's probably going to be some combination of those two things, is my hope, but we are a long way from there, my friend.
I think you bring up an interesting point that I hadn't really considered too much or drilled down on, let's say, which is that there's something fundamentally wrong in terms of what generates the negative outcomes. There's something fundamentally wrong with the system, the structure, the incentive structure, the sick care structure, the widget, in a factory effect, just limited time, limited resources per person, et cetera, et cetera. But what about also like the science? To what extent is the science evolving? Do we have a better understanding of what's driving these negative outcomes, et cetera?
Yeah, I think certainly, science is continuing to show us what is actually behind most of these chronic diseases. I think, frankly, when you step back and look at it, most of it is probably the environmental impacts that we sort of put ourselves around, and there is a lot more science sort of proving all of that as well. Things like exercise and what we're putting into our body and how much we're sleeping are clearly drivers of chronic disease. But even deeper than that, understanding things like our genetic profile, understanding epigenetics and how exposure to BPAs or phthalates may, turn on different genes or turn off different genes or drive different enzymes. I think all of that we're starting to really understand a bit more. There was a very clear break point in history. There's something called the Flexner Report in the early 1900s, where there was a division between sick care and wellness and prevention. And wellness and prevention was really put kind of squarely in the responsibility or the court of public health officials. And, we think about, clean water and clean air and sanitation and things like that. But really, all of the drivers that we know now that science is really proving over and over around what actually drives chronic disease are really in that camp. The other side of things, where most physicians are actually taught and where we are spend most of our training and where all the guidelines sort of exist, are all around sick care, around managing patients once they've sort of developed these chronic diseases. And so we will continue to see major evolution and understanding in what drives things like obesity and diabetes and cancer and neurodegenerative diseases. Fundamentally, though, I think our understanding right now still, there's no magic pill, Jack, right? Like, we all have to live healthfully, and it's not that hard to understand what those things really are. But being able to have a data-driven approach to an individualized care plan for us that helps us understand our chronic disease risk and manage those in a meaningful way, I think is really the next evolution of where we're heading.
Absolutely. I mean, that was the vision and is the vision and the mission of Rebel Health Alliance. We create a customized, ground up, I like to say inside out care plan for our patients, because it starts with your DNA. I mean, we're talking about analyzing you as a unique individual, creating precision and custom guidance, supplement plans, nutritional plans, exercise plans, and in case of need be, pharma, prescriptions and pharmacological interventions and whatnot, which of course are last resort, but sometimes they're definitely needed. And for those of us who are looking to get optimized 100%, there's definitely some tools that you can use to help put yourself, from that 70, 80% all the way up to like 99th percentile performance, which is where I am. I like that sort of optimization. Let's move on to discuss sort of the historical context here, because our system is completely and totally screwed up, but it didn't happen overnight. There's been a number of historical events, things that have transpired over time that have led us to this condition. And if we're going to solve these problems, it's important to understand how and why we got here. So I think, Dr. Deep, we've talked about this before. I mean, this goes all the way back to like the Great Depression. The way we have ended, or where we've ended up, was not something that just happened with Obamacare or something that just occurred in the last decade or even 25 years. This goes all the way back to the 20s and the 30s, doesn't it?
Yeah, absolutely, Jack. I mean, this story is a long story, and it's helpful to understand sort of how we got here. There are a few different eras to really unpack. There's kind of the Great Depression, the World War II era, the Vietnam era, and we'll talk about why, and sort of current day as well. And I think whether they are societal changes and wins or they are landmark legislation, there have been punctuated moments throughout the past 150 years or so that have led us to this moment of our sick care system. So let's talk about a few of those. You mentioned the Great Depression. If we start there, really even earlier than that, there really wasn't much of a healthcare system, quote unquote. I mean, you can look back into the 1700s, and I think John Adams or someone created a like a fund to help seamen with their hospital bills when they came back from sea and were sick. There was a healthcare fund that was started post Civil War for recently emancipated slaves who were, unfortunately suffering from all sorts of illnesses and sicknesses. But really, the Great Depression sort of sets the stage where folks are clearly in a world of hurt, and we get into World War II. And what happened is the government put wage fixes on companies so that we could adequately recruit workers into all sorts of different industries that we needed in order to support the war efforts. And so you weren't allowed to raise your salaries and compete in that way. And so employers started to offer benefits, things like meals and housing in some instances, and healthcare became one of the major things here. So, the IRS shortly after World War II ruled that or during World War II ruled that employers could make contributions to healthcare pre-tax on behalf of their employees. And that sort of made the system stick. That sort of set the stage for the employer-based system of care that we have right now. Fast forward to the 60s. So 1964, I think, JFK gets shot. 1965 is one of the biggest years in history. First of all, Jack, who do you think shot JFK?
uh, I don't really have an opinion on the matter. Oliver Stone really shook me up with that whole back and to the left thing, back and to the left. So, at this point, I'll believe just about anything about past historical events.
My favorite conspiracy is that he was warned the day before, and they swapped out a body double, and he's still alive. So who knows? Anyways, JFK gets shot. 1965 must have been one of the craziest years of all time. Lyndon Johnson signed the Social Security Act, which essentially formed Medicare and Medicaid, which was the response to sort of the employer-based healthcare system that we had. It offered a safety net for our older seniors and for those who didn't have the ability to work or be employed or weren't offered those. So LBJ's Great Society, is really pushing a lot of different things. In 65, we signed the Social Security Act, which created Medicare and Medicaid. We signed the Apollo program, enacted the Higher Education Act of 1965, which established federal student loans, signed the Immigration and Nationality Act of 1965, which laid the groundwork for immigration today. And so, that was a real pivotal landmark moment in American healthcare, and kind of set up the stage for both employer-based, which covers about 50% of our population now, and government-based healthcare financing in this country, and effectively then removed the ability for physicians, clinicians to interact directly with patients. There's now forever from that moment a middleman, a entity that is deciding what patients get to receive and what kind of treatments physicians will get paid for. And that has had profound impact on everything you see in healthcare. When you really boil it down, as much as we want to believe that all of our physicians and all of our healthcare providers are altruistic, human nature is human nature. And whatever incentives you set up, people will chase those. And so we do kind of what makes us money from these middlemen, from these insurance companies, rather than what does right by the people who we have committed to and who are trusting us with their lives and their wellness. The customer, quote unquote, in healthcare in many circumstances is not the patient. It is the insurance company, the one that is paying you. And so you're kind of a slave to them. I am not making a comment here on the importance of statins or any other kinds of medications. I think it's a very individualized choice, but I know a lot of patients feel pressured when they go talk to their doctor about certain things like, well, why are you pushing this one particular med on me so hard? Or why are you really wanting me to get this, screening? And it's always easy for us to say because that's best and the evidence would suggest that, but frankly, there are a lot of metrics that we're held accountable to where we are bonused for having a particular number of our patients on statins or a particular number of our patients vaccinated or screened for colon cancer. And, some of these things are good. Obviously, we want to make sure that, people's blood pressure is controlled and diabetes are controlled. But there are insidious ways in which behavior from physicians and clinicians are strong armed because of the subtle incentive structures that exist in the background. So 1965, we had all of these changes that set the stage. And really, we didn't have a single other legislation until the Affordable Care Act that as profoundly changed healthcare as any other act. So we go basically 50 years with this system entrenched and continuing to enrich the pockets of the incumbents and the few and create a system that is the Frankenstein that we see now. So, there's a lot of comments around the Affordable Care Act and what that did. Really, the legislation was really there more than anything to address the uninsured. And it did do that. If you think about the numbers, now we're down to about 10% of our population, 30% or 30 million folks or so are uninsured. But it certainly entrenched the insurance system even more. Last year, you look at some of the profits of these major healthcare organizations. United pulls in $50 billion of profit. They employ 100,000 physicians in this country. That's about 10% of the physician workforce. For us to imagine that an organization that is Fortune 5 company, one of the largest profit drivers in our entire economy, one of the largest employers of physicians and clinicians and pharmacists, one of the biggest owners of our PBMs and our pharmaceuticals. What do we think is going to happen? These companies have a fiduciary responsibility to their shareholders to drive a profit. So the primary outcome is not health and wellness of the population that is being served. It is profit. And to say anything else is just silly. The evidence is clear and abounds there. But you understand now with that depth of explanation why our system is set up like it is, why we are pushing volume over value, why we care about check marks and check boxes instead of understanding individuals for who they actually are.
Truly, there's not a single doctor that goes to medical school wakes up with like, I'm going to medical school so I can learn how to screw people over with the insurance company. No, that's not a thing. They all want to actually help people. It's what happens is when they get into, I'm sure some of the disillusionment begins in medical school, but once you really get out there into the real world and you start seeing, doctors are grumpy. Like doctors are grumpy about this. Like doctor satisfaction is not high either, right? Like patient satisfaction is low and physician provider satisfaction is low. And we're seeing an exodus of physicians from the system, which is also super alarming because then if you're left in the system, the quality of care you're getting is declining even more precipitously because the system is screwed up and then the inputs into the system are getting worse because all the good smart doctors are breaking out on their own and doing stuff like you're doing. What else stands out to you in terms of the negative outcomes that people are experiencing that are a good example of how everything is really not working out very well?
let's talk about some of the more concerning trends in society. Like you said, we have exploded the number of chronic diseases. 6 in 10 Americans have at least one chronic disease, and 4 in 10 have at least two, which is crazy to think, right? Like literally more than half of the people you look at out there have a chronic disease like high blood pressure, diabetes, or COPD. And almost half of people out there have two, often requiring medications, often requiring treatments, often requiring time off of work and productivity loss from needing to attend appointments and dealing with the outcomes of these diseases. Obesity was 30% or so in the year 2000. Now we're at 45% or so, and there's no stopping that number. There's no sign that trajectory or that velocity is shifting at all. Cancer rates are exploding. We have literally less than 10% of adults age 35 or older are receiving all of the recommended high priority preventative screenings that they can. This is something we talk about at Rebel Health a lot, which is we don't want you to just live until you're 90, but be stroked out or have a heart attack and be paralyzed in a nursing home. That is not the existence that anyone wants. We want you to be a vibrant, bright 90-year-old that's hiking the Rockies and attending your grandkids, weddings and traveling with your loved one. And the way we need to do that is by staying up to date on your health and identifying things early, ensuring that you're getting the recommended screenings. But, unfortunately, most of us wait as we've developed until we've developed, a disease or a condition. And now we are part of the sick care medical industrial complex. These list goes on and on. Arthritis rates, Alzheimer's, dental diseases. You mentioned diabetes. We spend $1.2 billion per day treating diabetes in this country.
$1 billion a day?
$1.2 billion a day, approximately $400 billion a year goes into treating diabetes and the complications of diabetes. We spend $4 trillion on healthcare every year. This is almost 20% of our GDP. You look at the discretionary spending for the Department of Defense, Department of Education, Department of Transportation, and add them all together, and we spend more than double that on healthcare every year. It's an economic crisis, the productivity loss, companies needing to spend a fifth of their revenue on providing care. That's only going up. It's literally never gone down, that percentage, year over year since we started measuring that.
It sounds like we're locked in a death spiral, and the whole thing is just, like a marble goes down a funnel. It's just like starting to just like pick up speed. But yet there's a select number of people out there, hopefully somebody like you who is listening to this, who sees all of this, wants to jettison from the current system, wants to make sure that their health is taken care of by people who see things clearly and understand the big picture, and are willing to ditch health insurance and are willing to go to a network that only exists if you get healthier. And that's what we're doing at Rebel Health. And all these things are why we have done this. Let's start talking about revolutionary solutions to this historic problem, this national crisis that we face, this giant structural problem that is not going to solve itself, and if left alone is going to basically consume the nation like Hungry Mungry from Shel Silverstein, if you remember that poem. Hungry Mungry. All right. Revolutionary systems. Deep. Do we need a complete overhaul of the existing healthcare system? And if so, what are the first steps that we need to take?
I think we do, but being a realist, what does that mean? We're not going to like blow this up and start overnight. There are hundreds, literally hundreds of millions of people who are sort of depending on the system to exist and at least strung together in whatever way they can. So I am hopeful in one way, as we talked about earlier, in this shift from a payment model to value-based care, where the bulk of health systems, of clinicians, can start to get paid to keep people healthy and well and living their best life, rather than just a sick care system. But that's not going to move fast enough, and it's not going to do enough. So I really think there are, three kind of aspects that each of us need to think about in our lives when we think about healthcare, right? Like, one is, how do I stay as healthy and vibrant as possible so that I never even need to access the healthcare system, so that I can take care of myself and my family in the best possible way? The second then is, okay, now if I do need something, we talked about the importance of sort of screenings and preventative care. I need a colonoscopy to make sure that there's no early signs of colon cancer. Then what I need is not some complex system that I have to navigate and is completely opaque. I have no idea how much that's going to cost me, or whether I'm going to get a surprise bill, or where I need to go. But it's something that's very clear, like Amazon, frankly, where you can sort of shop for that, understand the price, understand the quality, and be able to book that in and be satisfied with your sort of experience. And then the last thing that we need is to make sure that in case something scary happens, we, get into a car wreck or have cancer, or, even some expected high expense like a pregnancy, that we're not on the hook for that. That really is the point of insurance, right? And what's interesting, I don't love these analogies, but oftentimes people will draw the comparison between healthcare and the auto industry, right? Like doctors and mechanics in some ways are similar, because something's off, something's wrong. You kind of have to go in and just trust that they're not screwing you over, and that they are telling you and diagnosing the problem appropriately, and then telling you the right kind of treatment, right? If you take that analogy one step further, though, and you think about insurance, like, you don't have car insurance for an oil change, or for a tire fill up, or the preventative kind of things. You have car insurance for when you get in a fucking crash and you need to really not be saddled with tens and thousands of dollars of cost. And so if you extend that to healthcare, a similar thing I actually think makes sense, in that we all, instead of spending $12,000 a year on trash coverage, where then whenever we engage with the healthcare system, we have to pay another $5,000, and then half of the things we even want aren't even covered. The cost for a family of four for minimum coverage in this country is $25,000. If you want the premium plan for family of four, Jack, you're literally talking $40,000 or $50,000 a year, when the median income in this country is $75,000. How stupid is that? That is not the point of health insurance. So instead of spending all that money and giving it to United so that they can scrape off a bunch of profit and tell your doctors that they need to prescribe you certain meds, why don't you engage directly with people who can spend an hour and a half, 2 hours with you, understanding things like your sleep and your diet and your exercise, your relationships, your psychology around food, what drives you, what you're afraid of, and works with an interdisciplinary team to kind of create that individualized, bespoke plan that we all want for ourselves and our families. So you need that pillar. You need that baseline of care that is not the 7-minute appointment, that is not the health system primary care preventative care that we have to offer. The other two aspects are continuing to emerge. There was a price transparency rule that actually Trump put in place that was I think one of the most profound yet quietest pieces of legislation around healthcare, in that Now, all of a sudden, healthcare institutions have to publish their prices transparently. The sad fact is, like, almost 75% of institutions are just in violation of that, and they're like willing to take the risk and take the penalty rather than tell you how much stuff costs. That's how messed up our system is. So, there are organizations like Mishi and others who are creating marketplaces for transparent bundled prices for things like that colonoscopy, or a steroid shot if you have the arthritis, or a shoulder replacement, or getting that mole looked at, or whatever you might need. You don't want to engage in the healthcare system. 60% of us avoid care because we are uncertain of the costs. You want to go into it knowing what it's going to cost. Just like every other industry in the world, we understand what we are getting for when we pay for it. And the last piece of making sure we have catastrophic coverage, there's all sorts of things out there. I think communities and networks that are coming together that will crowdfund one another. You can even buy indemnity insurances from Aflac or whatever that says, any cost or expense over $10,000 or $15,000, then you are absolved from. All of that, getting that kind of comprehensive care is much cheaper than paying your $12,000 premium and your $5,000 deductible. And you get so much more from that. So I am hopeful, Jack. I am optimistic that enough of us are understanding the evils of the system, are finding ways to create networks, communities, systems outside of the status quo that will allow all of us to live and flourish in ways that we all deserve. That being in one of the most advanced cultures and societies in the world, we can't just let this happen to us. Each of us owes it to ourselves, our families, our patients, and our communities, those around us, our employees, our colleagues, to break free, to not allow ourselves to just be passive victims in this sea of turmoil. Rather, let us come together as a community, as a network, build what we know needs to be built, focus on those three core pillars of really robust primary, preventative, individualized care, transparent bundled procedures when we need them, and helping one another out through community and other networks when we have catastrophes, just like insurance was always sort of meant to be. And Jack, we're building that. And I'm excited for the future, as fucked up as everything is, and as much of a picture as we've painted. It gives me great energy and conviction every single day to wake up and build this system with awesome leaders and partners like you, with our community of patients and others, and all of you watching this. But it's going to take all of us. So I hope that we can continue to, forge into the future with the feeling of confidence and optimism.
And that right there, ladies and gentlemen, is why you're going to hit subscribe to this channel. You're going to share this video with your friends, and you're going to go to rebelhealthalliance.io and sign up on our mailing list, or even just sign up straight away to join us, because this is the solution to the problem. We have cracked the code. We're offering the blueprint for tomorrow for the most important issue facing America today. I mean, I'm shouting this from the rooftops. I'm like talking about it constantly on Twitter. And it's not solely because this is where our business is. This is such a massive problem, and we have really found the solution. When we started putting together Rebel Health, people would ask me, like, what's my total, health economic landscape look like? If you're not taking insurance, then should I have insurance? What do I do? And, at first we didn't really have the definitive answer. But we've spent a year working on this, and we've seen all the pieces that are out there. You're working on Mishi, which is a cash play marketplace that connects providers and patients with just clear, transparent pricing that's low cost. Mishi helped me the other day get 2 cortisone shots in my knees for my arthritis that my original doctor wanted to charge me like $1,100-$1,200 for. Mishy was like, no, you can go here and get it for $250. Boom, done. And it was awesome. And then the catastrophic part, there are community-based out there that like Crowd Health, for example, where I'm a member. I spend $52 a month base, and then every so often I have to chip in happily to take care of somebody else's health, crisis. I've never paid more than $150 a month. And if I get run over by a car tomorrow, they'll pay for everything. And that's what insurance was supposed to be like. So we have found a way for us to all be healthier, save money, be freer. Like this is like the trifecta that I think is going to speak to a lot of people. Who doesn't want to save money, be healthier, and have more freedom in their life? And that's really what we're all about. And that's why you should join us. You should hit subscribe. You should share this video. Come back to the channel. We're going to have a lot more. We're going to talk about all the various ways that we can work on our own longevity. We're going to talk about health and wellness tips. We're going to talk about the cutting edge of treatments, of peptides, hormones, of just new stuff that comes down the pike. Heck, we'll talk about gene editing maybe at one point. We're just going to explore all the various factors that can help you be your best self, to perform at the highest level possible, and to extend the amount of time that you're there for you and your loved ones.